Assalamualaikum and good morning to all of you. I'm Hazrina binti Ghazali. Today with my student Rozaida binti Muhammad Amin, we are going to present our paper entitled Factors Influence Job Stress Among Employees in Food Service Department at Private Hospital within Klang Valley, Malaysia. So this is the presentation flow. I will start with the introduction, literature review, methodology, results and discussion, and lastly, to conclude this research. Okay, institutional food service is a service that provides food to their groups of customers in the institution, which can be found in hospital, facilities, school, prison, child and senior care center, and also catering services. And food service become an important issue in hospital setting because to recover patient needs a balanced diet, good food, balanced food, in addition to medical supplies and also treatment. So based on previous study, we found out that there are limited studies conducted focus on the institutional food service industry in Malaysia. And based on our reading, we found out that Malaysian employees were overworked, less sleep, with 51% suffering from at least one dimension of work-related stress, as well as 53% getting less than 7 hours of sleep in a 24 hours period. And public health sector employees were among those who have the highest level of stress as compared to employees from other sectors. And burnout and turnover within the hospital food service sector also considered as high. Okay, this is the research objective of our paper. First, to examine potential factors that influence the job stress among the food service employees in the private hospital. Number two, to identify the most influential factor that cause job stress among the food service employee in the private hospital. And lastly, to examine the relationship between employees' demographic characteristic and also job stress. So this is the conceptual framework for this paper. We have working environment, salary, workload as the independent variable, and for the dependent variable we have job stress. Okay, these are the literature review we referred for our paper, for our study. Okay, so this is for the workload variable, this is for the working environment, and this one is for salary. Okay, we move to the methodology part. So this paper is the quantitative method, non-experimental research design. And for the sampling method, it was non-probability sampling, convenience sampling, and 126 respondents participated in this study, and the respondents were employees in institutional food service department from 7 private hospitals within Klang Valley area. Okay, this is the data collection procedure. Okay, we have 3 phases involved in this study. With the first phase, we approach and get approval from the management of the hospital. Phase 2, we distribute the questionnaire with the help of management department. And lastly, we collect back the questionnaire within the time given. Okay, for your information, the data collection was done before COVID-19 pandemic hit Malaysia and also global. Yeah. Okay, this is the research instrument for this study. We have 4 sections. We have employees' job stress. We have work environment, salary, workload under the section B. We also have perceived stress scale and also demographic profile of the respondent. Okay, we move to the data analysis. Our collected data, we use SPSS version 25. Okay, for the analysis of demographic profile of respondent, there were 55% respondent were female and 45% were male employees. And in terms of race, majority was Malay, followed by Indian 10%, and Chinese and also other race. Majority of our respondents were within the young group from 20 to 29 years old. Okay, for the marital status, majority of them were single, and majority of them had diploma certificate. Okay, this is for the work experience. Majority of them had 2 to 4 years work experience in the food service industry. Okay, in terms of the managerial and non-managerial, majority of respondents were non-managerial employees. Okay, this is the reliability analysis. Okay, we move to the results and discussion. We will discuss first objective 1, to examine potential factors that influence the job stress among food service employees in private hospitals. To achieve the objective 1, we use Pearson correlation analysis, and result shows that workload and working environment had negative correlation, and workload and salary shows a weak positive correlation. Same goes to salary, and working environment also shows a weak positive correlation. Okay, in terms of descriptive analysis, employees of selected private hospital in Klang Valley experience job stress from rarely to sometimes with a scale between 2 to 3. Salary was identified as the highest mean score with 4.2, followed by working environment 4.1 and workload 2.9. Hence, we can say that factors that influence job stress among employees in the institutional food service industry was between disagree and strongly agree with the scale range between 2 to 5. Okay, we also analyze the perceived stress scale PSS among respondents. Okay, employees in the institutional food service industry perceive moderate to high stress level. And with a scale of 14 to 26 score, 56 of the respondents accounted for 44% perceive a moderate level of stress, and higher scale of 27 to 40 score, majority of respondents accounted for 56% perceive a high level of stress. Okay, for objective 2, to identify the most influential factor that cause job stress among the food service employees in the private hospital. So we use multiple linear regression, and the model summary output the R squared 77.9% of variance in the job stress was explained by the independent variables used in this study, which are workload, working environment, and also salary. And in terms of beta coefficient, workload is the most significant predictors that influence the job stress. Okay, for the last objective, to examine the relationship between employees' demographic characteristic and job stress, we use this t-test to see the difference between gender and job stress and department versus job stress. Okay, we use one-way ANOVA to look at the difference between marital status and job stress, and the output of the analysis found that there were statistically significant difference between marital status and job stress. So this outcome indicate that the difference between employees' marital status influence job stress among food service employees at private hospital. So we move to the conclusion. The paper results obtained found that workload and working environment influence job stress. Okay, the most influential factor identified was workload, and working environment, workload shows that there were negative correlation. Workload and salary shows a weak positive correlation. Salary and the working environment also show a weak positive correlation, and for the department and marital status influence employees' job stress while gender did not influence. Okay, for the contribution and implication, findings obtained from this research expected to help management of the food service department of healthcare centers or private hospital to highlight and pay more attention towards the main factor that influence the job stress among their employees. And management also can help the employees to keep motivated and able to give an excellent work performance and avoid job burnout or job stress. So, limitation and recommendation is study use quantitative research approach using self-administered questionnaire. Okay, so it is suggested future researcher to employ mixed method approach to get more enriched data. Research area was focused on private hospital within the Klang Valley only, and it is suggested future research to increase the sample size and also widen the location. The sample size was small, and maybe in future can increase the sample size. To explore other variables that may influence job stress, because this research only focus on 3 variables. And the last, limitation, time constraint and limited budget. And for the recommendation, sufficient time with a good funding will help to wider sample size and location. So that's all about our research, and these are references used for this study. So that's all from me. Thank you very much.